Hey again, everybody. It is time for Q&A with A&V. I am Vincent Racaniello, and across from me, 40 miles away at Columbia University, is Amy Rosenfeld. Hello, Amy.
Hello, I am A.
How's your day been, Amy?
It didn't start off so good, but it's ending very well.
Oh, because you're doing a live stream with me, eh?
No, because I got a piece of a mass adapted virus that I've been wanting, and now I can start, passaging and understanding how it got adapted.
So, a good part of the discussion right now is about clotting issues.
Yeah, well, we're not gynecologists, and
What
we're
did you say?
not,
We're not gynecologists?
yeah, we're not gynecologists.
No. All right.
So,
So,
what about like the first one, Tom Tracy? What about oral contraceptive factor related to the clot? Well, in birth control pills, estrogen, and actually it doesn't even matter in birth control pills. Estrogen, just in general, is a clotting protein. It stimulates clot formation. If you have questions, you should talk to your OBGYN.
well, the people here are not the ones who had clotting disorders. They're just curious. But birth control pills can cause clotting, right?
Yes, it's estrogen and progesterone.
Right.
And
So,
and replacement hormone therapy for menopausal women, and taking the pill after, which is like a big bolus of, I think, progesterone and estrogen, or maybe it's just progesterone. They're all clotting factors and or stimulate clotting, and we don't need to rehash the story I told on Twitter, which was
adenovirus
rather
vectored
upsetting.
adenovirus vectored cancino. This is the China ad vectored vaccine. I haven't seen any data on that. Did we do that on Twiv? Was that we did one China vaccine? I don't remember if it was the ad or
No,
the. I think it was the inactivated, right?
yes, yes,
So that's the thing now. If So first AstraZeneca, now J&J, both adenovirus vectored. So of course you think maybe it's the ad. So we'll see these other adenovirus vectored vaccines, CanSino, the Sputnik.
well, it is the ad because one is spike stabilized, one is not. So it's definitely the ad. I mean, you don't have to be a rocket scientist.
I'm actually not a rocket scientist.
Well,
Are you familiar with B viruses treated with extracts from mushrooms? No. I know there are quite a few B viruses, including the B paralysis virus. Is that a dicystrovirus, Amy?
yes, that's what Michelle works on, right?
Michelle Hennigan, yep,
Mich-
over in Bozeman.
Yeah.
Okay, testing. If I select only symptomatic patients in their first few days, will nasal swab for antigen and PCR have different sensitivity?
Yes.
Yeah, any two tests will be different, right? Because they're never exactly the same, right, Amy?
Right. It's not even equivalent. It's like saying I bought an orange and then I bought a peach. Were they the same sweetness? No.
Hey, Doug, you should have said D614G for your name because you got D416 instead of 614. Do we
Close
believe we are
enough.
getting good surveillance data on other ad vectors like Sputnik? Who said the other day that they weren't sure that we are going to get good data from that? Was it you, Amy?
It was me.
Yeah, Amy's skeptical, but we'll see, right? What can we do? I don't have a hotline to Putin, so I can't get the data.
Oh, your red phone is on the fritz?
Okay. I read an article where a New Jersey man was hospitalized with COVID a few weeks after receiving J&J. Could someone still get a monoclonal after the vaccine if they become ill? Yeah, so maybe the vaccine immunity hadn't kicked in yet, and so I don't see why not, right? You could give them monoclonal, right?
Yes. I think Daniel has talked about it.
Yeah, Sputnik 5. No issues so far as long as they're telling us, right?
Yeah, but also it depends on how many people have received the vaccine.
Yeah.
Um, so like You know, you did a trial of 40,000 and you said you aren't going to pick up an event that occurs in out of every 1 million or 5 million people. So depends on how many people have received the vaccine.
Is there any direct evidence of cause effect where because AZ clots they started searching for J&J related?
No, it's because some lady died.
I mean, some people feel that the story isn't resolved yet. Daniel seemed to think it was a good association, but I don't know. I think it's worth, pausing like they're doing, though.
Yeah, well, they've decided that they're not going to allow them to go for at least a week minimum because they want more data. So the FDA said they'll convene again next week. Come back.
How do they make monoclonals long lasting? The new Glaxo lasts a year. Is that right? It lasts a year? That's amazing.
Yes.
Well, I don't know how they do that. Do you know, Amy?
No, I don't know anything about how
Because
they.
Regeneron, you can pegylate the antibodies and give them a couple of months. There are a lot of tricks like that, proprietary tricks. But Glaxo lasting a year, I'm not aware of that. That's very interesting. And how do they
But
know?
it
Well,
could just. Go ahead.
they do studies in animals where they track them over time and they extrapolate the people. Go ahead, Amy.
Yeah, but I mean, there's hundreds of different forms of PEG. And I believe that some of the pegylated interferon that they used to give for HCV patients lasted a long period of time.
Yeah.
So.
Amy time, yippee.
It's cute. I say yippee all the time.
Yeah, Arthur asked me where my family's from. I said Basilicata.
That's not Sicily.
No, it's not too far though. 6 degrees and cloudy in Chicago. Wow.
Wait, how do you get from like near Rome and not too far from Sicily?
No,
like,
it's Naples. It's not near Rome. It's south of Rome. It's quite far from Rome. It's 3 hours from Naples.
Oh, okay.
Why not do monoclonals yearly and change them up? They're really expensive.
Well, what's the point? You are not building your own immune response. So I don't see why I would want to do that. I want my own immune response because that will protect me. I will never have to worry and stuff. And yeah, I don't want monoclonals every year.
And also, I think they're talking about prophylaxis, though. I saw an article the other day.
Yeah, Regeneron says that if you have somebody who's positive in your house, you should give the whole household who has been testing negative at monoclonals as a prophylactic. And then they see like an 80% drop in the population of the house have it getting infected.
Mm-hmm.
I don't know. I think for $3,000, that's a bit much, but what do I know?
Oh, how does the antibody mechanism work? We really don't know, right? I mean, Daniel said he thought it might be or maybe we said the other day, Amy. Amy was on TWIV yesterday, by the way. You'll hear it this week.
Yeah, tonight, midnight.
Autoimmune reaction. You'll probably be up, right?
Yes.
Autoimmune reaction, and then so the antibody against the viral protein is cross-reacting with a cytokine involved in clotting. That's what Daniel said. You didn't say that, right?
No. I don't think that's correct. It's an autoimmune antibody. It's an autoantibody that is somehow stimulated by the vaccine, and it interacts with like clotting factor 4 or something. And then it throws these clots, which are, so I believe, like maybe heparin resistant or something. I don't really know. I just remember there was something about heparin.
It's not molecular mimicry then?
No. It's not molecular mimicry.
Okay. All right. Well, they could sort that out. They can get serum from these people. And by the way, one of the curious things is that these people get it so many days after immunization, right? It's like, what is it, 11 to something days?
No, it's like 4 days. That's my problem about it being linked to the being like an immune response
Well,
to the
here the
vaccine.
FDA today
It's
said
4 days.
6 to 13 days after vaccination, according to the FDA statement. Okay.
Well, even still, what antibody do you have at 6 days?
It might be a little bit. I don't know. But it
No,
might not be an antibody. You're saying that, okay.
it's an
I don't know, Amy.
autoimmune antibody. It's an
I don't know.
autoantibody. So it's a antibody that you've already had that's somehow activated
Yeah, well,
by.
it's we're
They'll
gonna need
deal
time
with
to
it.
sort this out, right?
Hmm.
Good evening, everyone. My eldest brother received AZ. My sister Sputnik. So far, no side effects. Good, but it's a small number,
Yeah, well,
right?
Andrew got AstraZeneca like 10 days ago. He's golfing. He's perfectly
Yeah,
fine.
I mean, these side effects are very rare, 1 in a million, right?
Yeah,
And people say
one.
to me, "Don't say 1 in a million. It's 6 in 6 million." Okay, fine.
What's the
Wendy, hey,
difference? You do some
Wendy,
division.
Wendy, is that your
No, that
sister? She
no,
loves you.
that's not Gordo.
It's a
It's not
dog.
Gordo. It is a dog, but it's not Gordo. Gordo is got a schnauzer face.
Will the new studio be decorated in shades of Racaniello and Rosenfeld? Wow, that's really good.
It is.
Put down that stick. I'll show myself out. I don't get that part. Do you?
Put down that stick. I'll show. I don't know. I don't
Is it
understand.
safe to get a booster with Pfizer if the first dose was J&J?
Yes.
I don't see why not. Yes, there's no research, so FDA wouldn't say to do it, but I think it's totally fine. And I got to tell you something. If Amy says it's fine, run with it. One of the smartest people I know.
I don't know.
Tracy says hello.
Hello.
Okay, George, wouldn't the original antigenic sin render potential COVID booster shots for the variants less effective for people who have been vaccinated with the current generation, assuming original antigenic sin happens with coronavirus, with SARS-CoV-2, right? It could.
Yeah, but that's not what Paul and Theodore are saying, so I'm not
What
going
do they
with that.
say? What do they say?
Well, their paper said that if you get back, like if you make antibodies, right, and then you come in with, I think they did it in animals anyway. If you come in with a variant, the variant
Mm-hmm.
like gets taken up, and the first round of antibody protection is from the stuff that you already have. And then the next round of protection is against the variant, because the variant is now taken up by your cell and presented on MHC, so that you'll find antibodies directed against the variant. So I'm not going with original antigenic sin.
But I tell you, folks, this is a good reason to stick around for these live streams for a while, because we're going to have research on all this stuff coming out over the next years.
No, we're not.
Not you, but people. Oh, you don't like any of it, right? People will be studying.
Well, it doesn't matter if I
responses.
like it or not. I don't think that after this year, I think that you will find that the money dries up just like it did for Zika.
Congratulations on getting your mouse adapted piece. You said that before. Isn't that
Yes, I'm
nice?
very
People listen to
excited.
you.
It's good.
Can you guess each other's favorite ice cream flavors and pizza topping? Who? Like me and Amy?
I know what your favorite pizza topping is. It's
What?
pepperoni.
It is.
It's
What's yours?
pepperoni. Black
I like
olives.
pizza. Black olives. And what's my favorite ice cream?
I would say vanilla,
Coffee.
but I don't. Oh, coffee. Okay.
What's yours? Let me say what
I was
yours
going
is.
to go with coffee, but
Yours is creme brulee.
no, it's not. I would have gone with coffee for you.
Can you
But
comment on
no, it's not.
Sinovacs? No, I can't. We haven't seen the numbers. But is this the one? Which one did China just say is 50%? Is that the inactivated?
Yes, that's the Sinovax is the one that the president of Argentina got and had no protection from. And then they came out and said it sucked.
Yeah, 50%. Mm-hmm.
Yeah, they came out and said it sucked. And that explains why the president of Argentina got vaccinated and developed COVID like 4 months later.
It's unfortunate.
Yes, it
But,
is.
we're lucky that the few that we've had here have worked really well. I think we're very lucky.
Yes, we're too American centric.
Can you tell a tale of the mouse house, Amy?
We went today and boosted our mice. We went, we saw the mice, we put some needles in their abdomen. Now they're running around. Tomorrow we're going to go get our new mice, put them in nice houses.
So the way
I
it
have to
works
order
is
20 HBs, remind me.
we have a special facility where we do infections of mice. So Amy and I go, we have to gown up, we have put a head thing on, a coat.
Oh, wait, today we had to put a shoe thingy on.
And they ran out of the head bonnets. So Amy put a shoe cover on her head. And then you put shoe covers on, you put gloves, and you go and you do your work, and then you come out and you throw it out. We do that a couple times a week.
Yeah. We're doing it again on Friday. Remind me, I have to email Veronica to get more head bonnets. I'm not putting more shoes on my head.
Yeah, I keep telling my friends, not really 1 in a million. Right. Does the ad vector result in ad antibodies? If yes, it is a single-time vector per ad strain use in the population. Actually, Spinney was talking about this a month or two ago, that some of the vectors actually, you can give more than one inoculation with the same serotype. And some you can't. Like the AstraZeneca, you can give 2 of the chimp ad26, and it seems to be okay. So I think it depends on the serotype. Raphael, 34 million vaccinated in Brazil. What's the population of Brazil, Raphael? Let's look it up. Brazil population, 213 million. Wow.
Well, their Supreme Court just told their government that they had to launch an investigation into basically their president's negligence.
Really? Good luck with that. Are there viral components that act as toxins, like that found in the lipopolysaccharide coat of certain enteric bacteria? You mean components of the virus particle?
I don't like the word toxins. So I don't like the word toxins because LPS is like a TLR2 and TLR4 stimulant, right? Mm-hmm. So I can, and we know that viral proteins are stimulants for different toll-like receptors. So I don't like the word toxin. So if you want to say, are there things that will stimulate an innate immune response like LPS does of certain enteric bacteria, then yes, there are. But I don't like the word toxin.
So there is a protein of rotavirus which causes the intestine to become permeable, and that's why you get diarrhea. And they call that an enterotoxin.
Yes, but like, like cholera toxin is like a pump, right? It pumps out calcium.
Yep.
I don't believe that LPS is a pump.
No.
I believe it's a glycoprotein.
It's a TLR ligand, right?
Right, and it's a glycoprotein, right?
So, DR, thank you for your super chat. What do you make of the work done obtaining a genetic signature for coronavirus based on detrended fluctuation analysis, random walking, and fractal dimension of random walking? Is this valid? No. I think, in my opinion, if you want to get insights on the biology of viruses, you have to do wet experiments. The others are all predictions. I mean, you could predict, but then you'd have to do an experiment to validate it.
Yeah, well, the weather, yeah. I'm not good with predictions. I don't like predictions.
Expats can now sign up and get COVID in Guangdong. In China,
Great.
It's the Chinese COVID. Good. That's good. Where's Novavax? We don't know. Just crickets. Just crickets. The experts should mention that if you've had the J&J vaccine beyond 3 weeks, you're not at risk for the clotting. That's correct. You can, bide your time there. Thank you, Lynn, for your super chat. Oh, very nice. All the donations here go to the studio, which we're trying to sign the lease on any day now. And then they have to do a little renovation, which shouldn't take long. And then I start to furnish it and start to do podcasts from there.
Yeah, we're going shopping.
And antigen tests have a large detection gap of a few days, according to Christian Drosten. Larger than the 2 hours Michael Mina told. Antigen test needs RNA not present in the first 2 days. Is this correct? No, you don't need RNA. I mean, you need RNA in the cell to make the antigen, right? What does this mean, Amy? A detection gap of a few days after infection? Is that the idea?
I don't know. I don't listen to him, so I don't know. I have any idea what he's talking about.
I would suspect that that's what he means. You have to, after you get infected, you need a delay before you're going to see much antigen, whereas the PCR you might see sooner. That's what I think.
Why would you see why would you really think that you're detecting input virus by the PCR?
No, not input. Maybe after 8 hours or 12 hours.
Well, then depending on what the antigen is targeting. If the antigen is targeting nucleocapsid, then you've made nucleocapsid way before you made RNA. Because you have to do translation before you do RNA synthesis. Otherwise, you have no polymerase and stuff. And nucleocapsid is the most dominant protein in the cell. So I don't know what he's talking about. I didn't listen.
Now that home antigen tests are approved, shouldn't this help timely intravenous monoclonal antibody therapy? I don't think so. I don't think a home test will help that, because you'll still have to have a PCR by your doctor, by the hospital, before they're going to give you a monoclonal.
I don't know what the policy is.
Some people will never get vaccinated. What's the holdup on cheap, rapid, at home? Well, cheap. The test we just mentioned is like over $100. Yeah, I don't know what the holdup is. Michael Minna said we were going to have it last year, but we never did.
Because he doesn't have any.
Doesn't. I don't know why.
Because there never were any to begin with.
But technically, you should be able to do it, right, Amy?
Technically is not the argument. I can technically do lots of things. I live in the real world. And the real world was, he came, he talked, and there was nothing.
I was choked on my lunch the other day, a week after my vaccine. Is that an adverse event? No, it's
No,
not.
don't eat so fast or take such big bites.
His point is that it's
I know what his point is.
Yeah. I read a recent article about a cheap vaccine using Newcastle disease virus and Hexapro.
Yeah, that's
what do you think?
Peter.
It's Peter Palazzi, my PhD advisor. It's a chicken virus with. They put 6 prolines into spike. You know, the current ones have two prolines, so they thought, let's put more in. It could be better. I don't get that logic, right? But it turns out it makes more antigen, so it could be useful. We'll see if it works.
I don't know. It's being tested in Thailand.
A mushroom extract fed to honeybees greatly reduces virus levels. Well, that's cool. I would like to see that paper. That sounds like a good TWIV paper. Public utility. I will look it up. All Canadian VIPIT tests go to McMaster. How common is it in other nations? How common is what? The test or the actual VIPIT? I don't know. Anyway, I don't know either way. Do you need to delay your second dose if you've been reinfected between shots?
No, according to Daniel, as long as you're feeling fine.
That's right. I got my second shot and the reaction is much stronger, fever, etc. Is that expected? That's what happened to me. My second Moderna, I got fever. Amy was knocked cold on the lab floor, though, because she came to work anyway.
I did.
And yes, expected for a boost. You're getting a really strong booster reaction. It's absolutely fine.
Mm-hmm.
Oh, look, a 45,000-fold reduction in Lake Sinai virus. Remember, that's another one, Lake Sinai virus, the B virus. I always like that name, excuse me.
I don't know where Lake Sinai is, because the lake that starts the Nile is Lake Victoria. Never heard of Lake Sinai.
Well, there's one in South Dakota.
Oh, that's good.
So, Important John wants to know if Israel and the UK have now achieved herd immunity. I don't know about the UK, but Israel apparently is over 90%. So, yes. Do you know about the UK, Amy?
They are on the way, but they have not achieved it yet. I believe they're at like 55%.
Have you seen the paper from Israel finding vaccinated people are 8 times more likely to be infected with the South African variant than unvaccinated? Amy and I have both seen it. We don't think it's very impressive, right, Amy?
Right.
Because they check these people really soon after the dose. And anyway, we don't care if they're infected. We want to know if they get disease or not. And I bet they don't, because the T cells are going to protect them.
That's true. I like T cells. I just sent you a paper about T cells. Look, somebody gave a super chat because he's me. He said, super chat, Amy fan.
Wendy says, I'm so pleased to have some continued support Twitter through Patreon. Thank you so much. I owe everybody on Patreon mugs and all kinds of things,
Oh,
T-shirts.
forget it.
I'll do it. Were there any other adenovirus-based vaccines in the past? Funny you should ask that. I just gave a lecture today in my course about therapeutic viruses, and there have not been any, I should say, licensed vaccines, right? But there certainly have been experimental vaccines. Would you like to see which ones they are? I can pull it up right here. Here we go. I'm going to show this to you guys. Look, this is my tech. So licensed vaccines, let's see, there's no ads here, okay. This was an HIV experimental vaccine. Ad5, Ad26 Ebola virus vaccine.
Did not work.
Did not work. What?
The first two did not work.
Yeah, this ad didn't work.
The influenza 5 influenza did not work.
Yeah,
The,
so
the HIV envelope, something or other, no.
But those
The
are the only two
MERS,
ads.
the MERS
But they're different vectors, Amy. She wants to know about ads.
Didn't work.
See, we can pull up information so quickly here. Vincent, that is why the mRNA vaccines are the best. Why? What's the reason? I forgot.
Because they don't have anything that would be like another virus that complicates it. It's just RNA.
Well, maybe we're all going to
we'll see.
mRNA. 60 Minutes did a piece on DARPA research showed a blood filter that was curing COVID patients. No, it wasn't filtering out virus. I don't know what they were doing. But it's not going to filter out virus. No, because there's not much virus in the blood anyway, and that's not driving the pathogenesis.
Well, I highly doubt that the filter was fine enough, because the only viruses that are filterable agents are the super viruses, super large viruses. They live in the ocean. They don't live in us. So they would fail your first test.
So Amy Dillon wants to know if you know any role of NK cells in different severities of COVID.
There have been some reports of the role of NK cells, but there's very little knowledge.
Just received the second Pfizer at noon. Should I expect all the fun to start overnight? Yeah, tomorrow you may wake up with some fever, but you'll be okay. Where are we with the Regeneron IM monoclonal? Didn't
Daniel talk about it?
It's in testing, right?
I believe so.
This is someone else. Sorry, Raphael. It's a long time since a big VOC hit the headlines. Is the virus changing less frequently or with less concerning changes? Neither, both. Well, because the initial excitement blew over, and slowly papers are coming out showing that a lot of the initial conclusions were not correct, like a Lancet paper this week saying that the UK variant actually is not more virulent. So I think people are starting to just be quiet.
Unfortunately, the damage is done.
What are the mechanics behind the term transmissible? Does it mean people emit more virus, more effective at binding to ACE2? Well, transmissible means it goes from one person to another, and if it's more transmissible, and technically you can infect more people. So the reproductive index is a measure of transmission, And what would regulate it is a good question. It could be more shedding. It could be more stable virus. It could be longer shedding from the nasopharynx. It could be antagonism in the host that allows the virus to establish itself. It could be all those things. Many more. And so when people say transmission, they don't really specify it. For people who are immunosuppressed, monoclonals can be beneficial. That's right, yes. That way you can be treated and you won't make your own immune response, obviously, because you're immunosuppressed. Why won't the federal government put people with early COVID at low or moderate risk of dying from accessing monoclonals?
What are you talking about? I thought that that's who they were targeting. I thought at the beginning that they thought you had to be in the hospital, and now I thought that it was early and during early infection. Otherwise, there's no point.
Well, you have to have risk factors like older age and other comorbidities, other diseases, obesity, and so forth. So diabetes, and that's why, Marie, that's why it's not recommended because it's not enough for everyone, I suppose, and you want to really take care of the people
you can put it in a biovat and just crank it out.
Do you think the current approval and wide use of mRNA vaccines will advance mRNA cancer therapy? Possibly, yeah.
Started out as a cancer therapy.
Oh, yeah? What were they delivering, Amy, with the mRNA?
So that was Moderna's whole platform is they started to use mRNA against cancers. And then they switched to infectious disease, the SARS-CoV-2.
Hello from San Antonio. Hello, San Antonio. Arlene, I have close friends in Armenia. Massive vaccine hesitancy, confusion, and denial, low amounts of vaccine, difficulty access, Sputnik available, some AZ. I'm sorry to hear that. As a legal and social researcher, what investigations can we do to help virologists better understand lay attitudes to vaccines and where medical laws could aid concept use? Loving the steeliness, Amy.
I don't know what that means.
Steely. You're steely.
What does that mean?
You're tough.
You had this discussion with the lady who picked on me the other day, who said
we're not picking on you.
I was unself-conscious, which means there has to be some cognitive decision about that, about who you are. And I don't know that I agree that there's a cognitive decision. And then said, I really like the fact she wears no makeup. Really? Don't you have anything else to criticize me about? What are you, my mom? Put on some mascara. Don't leave your house without any lipstick.
Anyway, Jack, you can figure out why there's vaccine denial, what is driving this, and figure out, well, as Amy has said before, the Supreme Court said it's fine to make people get a vaccine, right, Amy?
Yeah, it's 1905 Jacobson versus Massachusetts. But actually, I think he needs to read the op-ed article that I talked about, I don't know, maybe 2 months ago, where this guy interviewed his friend who is vaccine hesitant. And he asked him all these questions to try and understand why he had made that conclusion. And you try to do it in a very non-judgmental way, and you ask all these different questions. And my response was, I don't have any patience for this. Either do it or don't do it. But don't give me some bullshit about why you're not doing it.
I think part of the issue is the states, because the states decide what they want to do no matter what the Supreme Court says, right?
No. But there's already problems. So today it came out in the Wall Street Journal. Okay. So Texas A&M, they want to make it so that you cannot go to class. They want to have in-person classes, and they want their whole student population to be vaccinated. And somehow you have to prove that you are vaccinated. Well, the governor has already said you cannot, as a business, ask anybody if they have been vaccinated or prove that they have been vaccinated. Now the university is kind of screwed because
they're not a business, are they? The university
they are a business. Of course it is. It's a nonprofit business.
You know, the governor, who's the governor to say that? He's the governor. That's what I said. The states are screwing it up.
Well, so the thing is that you have to understand why the Republicans or these conservative people have interpreted the Second Amendment as, which says you can have, you have the right to bear arms, as infringement of your personal rights. And then you have to go back in history and you have to understand what we do. And what we do is what Jacobson in Massachusetts says. And what that says is, in the context of a public emergency, a public health emergency, you can restrict your individual rights for the good of the public. And then when that emergency is over, then you return those rights. And for some reason, the Republicans have convinced all of these people that we never return rights, that we just constrict, and soon we'll have zero rights. And that is not what the history of this country is. So if you actually took history classes and you were taught the right thing, then you would know. But we don't do that.
Amy, do gain-of-function experiments introduce two viruses to get recombination?
Well, some do. That's what our friends do, but we don't. It's not. Well, at least we don't at this particular point in time. That's on the plans, but that's not.
So what I think you do is you make specific recombinants using DNA, viral DNA. You cut and paste. Because if you throw two viruses in a cell, how do you know what's going to recombine? If you have a specific goal.
That's exactly what Barton does. He takes two forms of polio and he asks for recombinants. And now he's doing
gain of function, though. He's not doing gain of function.
And technically he is. He took two defective polios and got polio.
Okay, fine.
That's gain of function.
Okay. What's the specific difference between Sinovac and J&J? Just the ad vector. Sinovac is ad 5 and J&J is 20, what is it, 21, 26. Okay, orange custard chocolate chip, University of Wisconsin. I've been to that ice cream stand at UW. Yeah, it's good. There's also one at Penn State.
I have not, but I do not like orange and chocolate together. Do not like fruit with my chocolate or chocolate with my fruit, I should say. So that would not be my choice. You can try again if you'd like to submit it. You can try again for my favorite ice cream flavor.
You think the proposed mechanism of clotting, an existing antibody interacting with a clotting target that causes pathology, could explain ME/CFS?
No.
I don't think so, because these clots can be life-threatening, right? So I think it's different.
Well, I have never heard Ian talk about clotting and ME/CFS. I've heard him talk about lots of other stuff, and he comes periodically to tell us his update, and not once does he talk about antibodies. Clotting. So
Catherine says, I hear MHC evasion has been detected. Bill Hazeltine's latest is concerning. I wouldn't believe a thing that Bill Hazeltine writes. He gets it wrong all the time. And I know him from years ago, so don't be concerned, because he is a fearmonger, very much like Michael Osterholm, although Michael Osterholm gets more things right. Because the spike is a fusogenic protein, is it capable of triggering coagulation? No,
form syncytia. That's what your paper on Friday said, and that's what Catania's paper said. Form syncytia.
Yeah, I don't think it triggers coagulation.
Coagulation is platelets. They're not really cells.
Thank you, Ditching the Grind, for your super sticker. President of Argentina was vaccinated with Sputnik 5, and in Argentina, the only Chinese one is Sinopharm.
Oh, well.
So which one is Sinopharm?
I got it wrong. Amy? I don't know. I got it wrong. I knew that he had gotten one, and it was not.
Okay.
It was not. It was thought not to be very effective.
Here's the lady with Minnie Mouse. See, I get it right this week. That's Minnie Mouse. Anything on the challenge trials? No, I have not heard a thing, and I'm glad. I'm glad I haven't heard a thing. Is a vaccine's ability to be sterilizing immunity dependent on the virus and its interaction with our immune system? Would all good HPV vaccines provide sterilizing immunity? Could a COVID vaccine ever provide? Well, my understanding is the HPV vaccine provides really good mucosal immunity, which is what you need to prevent infection, because the vaccine has a lot of protein, much more than a natural infection would generate. I don't know if that's the only factor. So if you could achieve high levels of antibody in the mucosa, you could do that with the SARS-CoV-2 vaccines, but the current ones do not, probably in part because they're injected in the muscle. And so mucosal immunity after that is limited. Amy, you
I don't know.
said you would.
I thought that we had a different philosophy.
What's our philosophy?
Well, sterilizing immunity generally occurs with viruses that have a viremic stage.
Yeah,
HPV
but
might
HPV
be.
doesn't.
I was going to say HPV might be the only exception that I can think
Yeah. Amy, you said you would wait for an attenuated vaccine. What changed your mind?
of. So I used someone's BSL-3, and he wanted everybody who was a BSL-3 user to get vaccinated. And so I would not be able to do experiments if I said no. And I do experiments for a living, and then I write grants and papers, and that's how I support Vincent, myself, and the lab. So it would not be good for me to say, so sorry, I refuse. Not a smart plan.
Hello from Montreal, wondering if there are any ideas on the relationship between vaccination and apparent relief from long COVID. Do you know anything about that, Amy?
Daniel.
He doesn't know. He said maybe there's some virus around and this is getting rid of it. I don't believe that. I think my idea, and it's completely a random thought, is that the vaccination is somehow putting the immune response back into order. It's out of order in long COVID, and somehow this is doing that through regulatory T cells, perhaps, but no data whatsoever. I'm wondering, in case vaccinated people get sick and transmit infection to others, in the long run, it may help create more variants.
What
No,
difference does it make if you create more variants? You won't get severe disease.
Are there any data on people that got infected after being fully vaccinated? I'm interested in severity of disease and the possibility of long COVID. No, there are no data. There are no papers. It's all really, it's very little, very few cases, and they haven't been reported yet. We just hear anecdotal information. Any thoughts on lab mice with extra long telomeres compared to wild mice? Is that true, Amy? I don't know.
I don't know. I don't work on telomeres. I'm not looking for longevity, but I don't think that can be right because Louis Caronte's stuff, right?
Mm-hmm.
You know, it's all about diet fat, right? And metabolism and reactive oxygen species and errors. So I don't know that that would be right.
Is Sinovac mRNA? No, it is not. I think that's the inactivated one. So China has two. CoronaVac is inactivated. Sinovac must be the adenovirus vector.
Could be.
Eddie says, got the J&J Saturday. I'm 26, male, slightly overweight. So besides sore arm, still nervous. Hopefully in 2 weeks. Well, you're male, so that's in your favor because most of the patients have been female, right? And they
have all been female.
They have all been? Okay.
Mm-hmm. Well, at least here the 6 were all female.
Mouse House, funny name. Yeah, that's what we call it. For years, we call it the Mouse House. Do you think the age restrictions on the AZ is appropriate? Well, if you're concerned about these effects being caused by the vaccine, then you would do an age restriction based on the age of people that you see it in. Now, remember, it's a very small sample, so it might be subject to a lot of noise.
Okay, one more. It's 8:45, and I have to add overlay.
Yes, 6 and 6 million, that's right, but clotting happened only in 18 to 48 of age. Shouldn't yes, I don't know the number in that group. That's absolutely right. But, there are two ways to look at it. There's an overall number, and then you're right, the number in that age group. I don't think they've given that out. You want
I don't
one
know,
more,
but I
Amy?
think that like Rich talked about this and how you can divide and divide and divide and divide all the groups in some answer to some letter yesterday on Twitter.
One more?
Sure.
How do researchers decide which doses and booster intervals of vaccines to test on large populations of volunteers? Do you want to answer that, Amy?
No, because I'm not part of the company and I don't do vaccine research.
So you do.
And so I don't really know why how you decide booster if you only look at one time point.
Well, you do experiments in animals first before you touch a
Yeah,
person.
but
You
there was
decide.
no way that you could have done that. You could have given a dose and then boosted the animal 8 months later.
No, you
Because
can't do that.
right.
So
So
that's one of the limitations, time. But whether you go with one or two doses is a question you have to address early. And they
right,
had
but
some
even if you
experience.
go 2 doses, how did you decide to go 2 doses? One company did 21 days, one company
Well,
did
that's random.
28
That's
days.
random.
Right.
No, I don't care about the
Versus
timing. I don't care about the timing. I just care about one or two doses. And you can establish that in animals. Non-human primates did better with two doses with the mRNA vaccines.
we really can't say that because we never actually let them go that far.
In the time frame they did better, yes.
Right.
That's what
And
we're
the
talking
time
about.
frame was 2 months. The time frame was very short because let's think about this. If you started developing a vaccine in January and your first human vaccinee was in December, there was no possible way that you gave an animal a vaccine and then waited 2 months to boost them and then take another population of animals, give them a vaccine and wait 4 months.
I understand that.
So
I'm just saying this is how the decisions are made.
well, I think that I think that they were made, but I think that they were made in a flawed fashion because you
Well,
titered.
that's another issue. But they were made based on animal preclinical experiments.
Right, but how
Whether
do
it's flawed or not
researchers
is another issue. I'm
right,
just saying how they're.
but if I come and I say I'm going to give you a dose and I then titer you at 11 days and I see no dose, then I'm going to give you another dose. But that's not really a sufficient way of saying that 2 doses was better. Because when you come back 11 days from the second dose and you see a higher titer, you really don't know if it's from the second dose or if it's really the first dose's antibody response to it that is now detectable.
Nevertheless, this is how it could be done if we had a lot of time. You want one more? Or are you done?
Sure, fine.
At the ACIP meeting today, it was highlighted that several of the 6 women experienced symptoms on their left side. Is that significant? Is there anything on the left side of the body, Amy? The
Well,
spleen?
that's where your heart is. No, I don't think your spleen is on the left side. I don't know where your spleen is. I think it's down the middle. But your heart tilts left.
Who knows? Good point. All right, Amy,
I
thank
don't
you.
really know. All right. We have to there was something I wanted to remind. We have to do something tomorrow.
I'm not in tomorrow.
Yeah, I know, but we can do it by Zoom. I forgot.
Okay. Okay.
And no,
Let me know.
my vanilla and salted caramel. No, those are not my favorite ice cream flavors. But they're all good
Salt is good.
guesses.
Salt is good.
I'm sure it's good, but it is not my favorite. They're all good guesses, but they are incorrect. So,
Bye,
all right,
Amy.
I have to go put on overlay. All right, bye.
Thank you. Okay. Would an oral or inhaled vaccine be likely to produce better respiratory mucosal immunity than injected? Yes, for sure. Would there be any merit in one dose oral inhaled and one dose injected? I'm not sure. I think you would be better off doing 2 inhaled if you wanted to do that. Okay. But I think an inhaled one would be good. The flu mist, I think, is very good. And there are some being in development, but they haven't come along as quickly as the mRNA injected vaccines, as you know. How are mice prevented from transmitting respiratory viruses to each other in the mouse house? Is each cage independently supplied at negative or positive pressure? How many mice are in there? So each cage, well, we don't, but our viruses are not transmitted among the mice by respiratory routes. And the mice are tested to make sure they're not infected when they go in there. And it's some of the, so where we do our infections, the cages just have a lid on them. They have no positive or negative pressure. In other parts of the Columbia Animal Facility, there are these wonderful racks where you slide the cage in and it hooks up with a ventilation port, which pulls air out of the cage and then filters it. It's very fancy, but we don't have that in our little lab where we infect. I'm in a clinical trial for Novavax. I get a crossover shot in April. Yeah, I'm suspecting in May we'll have the Novavax results. Yeah. I don't know of any spike mutants that evade T-cell immunity. According to Alessandro Sette, no, they do not. Yes, Amy was on form tonight. You should notice I can't get anything past her. Sinovac efficiency is pretty high at avoiding severe COVID and deaths. For the moment, sounds okay. That's fine. That's what you want. Infection doesn't really matter. Thanks, James, for your super chat. And thank you, Jack, for your super chat. Would a GWAS and health issues research, including any autoimmune diseases, body mass index, past smoker, any birth control pregnancies, any thrombosis? What's the rest of the question? Would that be useful? Yes, for sure. Presumably people are doing that. Is the adolescent dose of Pfizer the same? I believe it is. I believe it is. Abbott Binax now was bought in bulk by the U.S. Yes, that's correct. But Binax now, $5. Yeah, I think it needs to be a lot cheaper. That was an antigen test, right? Yeah. The UK lateral flow is available for everyone twice a week. This is terrific. Seriously, that's great. Does everyone do it? I wonder what impact it's had. That's great. What's up with the so-called double mutant variant? Nothing's up with it. It's just circulating. The reason there are cases is because people are out and about. Frank said tonight, our moderator, that he went to an office and the people were not wearing masks. And this happens all over the place. That's why people get infected, not because of variants. I haven't seen anything special about the double mutant. I mean, all of the variants have more than one mutation. Okay, so to say this is the double mutant, which is being called in the press, I understand, is not really accurate. 50% immunity or vaccination in the UK, or combination of infection and vaccination. Okay, that's what Amy said before, right? Have you seen adenoplatelet interaction? Yes. So adenovirus, as Kathy Spindler said last week, can bind platelets. Some adenoviruses can do that. It's not clear that it is related to this, though. Does it matter if you take aspirin, Tylenol, or ibuprofen? Whatever you like. Daniel Griffin says whatever you like to take after the vaccine is fine. Was there an Israeli study about PPE not being as protective? Okay, so this, I hate that you put it that way because it sounds like PPE doesn't work. What this was a super spreader event where everyone was wearing masks in a healthcare setting and the virus still transmitted to a lot of people. And the idea is that it was perhaps very fine droplets that got around the mask. I don't think it says at all that the masks aren't useful. I think this was a very special event. And who knows if there were, they said they ruled out contact exposure, but I'm not sure they could have. For the Novavax phase 3 crossover, what's the purpose of maintaining everyone's blindness by bringing back even those who were originally vaccinated? I don't know. That's a good question. If anyone knows, don't know. I haven't looked into that. Can you know by a lab test the vaccine that was inoculated? No, because the only one, so for the mRNA vaccines, the adenovirus vectored vaccines, you're getting just the spike protein. And so if you did an antibody test, say, for N protein and spike, and it only came up spike positive, you likely got a spike-based vaccine, but you don't know if it's mRNA or adenovirus. The inactivated vaccine has got N protein, so it's going to give you antibodies to N and spike, but that could also happen from a natural infection. No, Tomas, the virus has already been isolated and purified a long time ago, so it's nonsense. Do we know how much viral transmission potential is lowered? I don't know, but I think it's going to be sufficient to establish herd immunity. I think people are worrying about this, but if the vaccination prevents disease, my suspicion is it's reducing viral titers sufficiently to prevent transmission. But studies are underway to assess that. So we'll know at some point. Thank you, Jack, for your super chat. Really appreciate it. And thank you, Public Utility, for the paper. I'm going to look at that. That sounds cool. I love bee viruses. Thank you, Susan, for your super chat. You said on Twitter that a long-term effect will appear within 6 months. Yeah, that was Paul Offit. And I think maybe it was you who sent an email to Charlotte Moser, who works with Paul Offit, and she said there are no references for that because they just put it together. But you know, if you look at all the vaccines that have been tried, that's the observation. I believe that's where it comes from. You might be able to find a review article that says that. I don't have it off my head. That's not the right phrase. Why doesn't J&J have a higher effectiveness against mild and moderate as compared with Pfizer? Well, maybe it makes less antigen. I don't know. It's one shot. I don't know. Could be any of those things. Not something we're likely to find out, right? Does the antibody virus complex activate complement? So this is an enveloped virus. And so antibody binding virus, yes, could activate complement. And then the complement could destroy the virus, right? You could have the membrane attack complex produced. And yes, it could. That's one idea of how complement may help eliminate viruses. Yes, for sure. Why can't we use a vector that's harmless to humans with the spike produced on it? I'll donate my bucket of bolts. Hey, you remember that episode? It's Bucket of Bolts. Well, I'll tell you, you think adenoviruses are not harmless, right? I presume. VSV vectors are pretty harmless, but none of the vaccines have that. They're in development. But there are insect viruses, insect flaviviruses and insect alpha viruses that do not infect people. Well, they don't replicate. They infect human cells and they deliver antigens, but they absolutely do not cause disease. You grow them up in insect cells. You put your gene in, you grow them up in insect cells. And when you give them to mice, at least, the mice are fine and they're protected. So these are coming forward. These are being developed for COVID vaccines, but obviously they're way behind. So I think that's the best to fit your question. Yes, 6 and 6.6. Absolutely. We need to be precise. I had COVID and recovered. Fever and chills. Should I expect anything after the second? I think since you had an infection, the first Pfizer is like a booster, and that's all you're going to do. I answered this question, but my name is Racaniello. I had a natural infection, received the first shot I had. Oh, that's the same question, yeah? You're not going to probably have much of a reaction after that booster. What's your reaction on Israel studies showing breakthrough on the South African variant, blah, blah, blah? Okay, I'm not impressed. They looked really early after vaccination. And they're looking for infection. I don't care if you're infected. You know what? You're going to be infected a year after you get a vaccine. You're just not going to get sick. Think of it. Shortly after vaccination, you have high titers of antibodies in your blood and in mucosal tissues. If you get infected, virus probably not going to get anywhere. A year later, the titers are much lower. You're going to be infected. It's going to take 2 or 3 days for the memory B cells to make antibodies. The T cells will come. They'll all eliminate infection. You won't get sick and you won't transmit. I don't care about this Israeli study saying it breaks through, because the homologous virus would break through probably. And they didn't look at disease. I think that's the important part. Did you hear about the guy that, quote, COVID cured his cancer? You know what? That is not surprising to me, because, that's the basis of viral oncotherapy. This idea that anecdotal data said when people had a viral infection, their cancer seemed to be reduced or go away. That's true. So I didn't see this, but it would not surprise me at all, because, yeah, maybe it can activate a T cell response. And in fact, when we do viral oncotherapy, that is what happens. You start to break up the cancer cells and it activates your immune response. Interesting. Well, if you want to get away from intravenous, you have to do more shots intramuscularly because it's a large volume of antibody. That's my understanding. Thank you, Abby, for your super chat. My sister in Australia got AstraZeneca. Well, as we said, you have the age and you have the timing, and hopefully she'll be okay. We have to wait and see how the world will end. When Osterholm makes his May prediction, he tends to do that. Yeah, he said March was going to be the worst month ever. I mean, it was bad, but it was not as bad as earlier in the year. And anyway, look, I don't think you should be overly hyping things. You shouldn't scare people, but the press loves it. And they always go to Osterholm, they go to Hotez, and I have respect for these people, but they overdo it. Now, you could say I overdo it too. But I'm not in the same category as Osterholm and Hotez. They have far more national prominence. Any research being done on why some of us don't experience any adverse effects? No, not for the vaccine. That's just a matter of the strength of your immune response. And people are an outbred population. Everybody's different. So everyone's going to have changes in genes that govern the strength of their immune response. I mean, people investigate that in other situations, but not specifically for the mRNA vaccine. You watch Threading the Needle. Do you foresee a time? Threading the Needle is the documentary we made, the TWIV team, me, Alan, and Rich. We got into the BSL-4 in Boston before it opened. Do you foresee a time when computers will supplant animal testing? Seeing the animal lab made me sad, especially for the primates. Yeah, it is sad, right? I mean, I'm sad when I go inoculate mice. I feel bad because they're little fuzzy guys, right? But has to be done. And the primates especially, yeah, I feel sad. Can we use computers? Gosh, it's going to be a while, I think. We're not even close. I mean, some people think you could stop doing wet experiments altogether and predict it, but that's a long time. And unfortunately, a lot of animals will die. Yeah. I mean, the good thing is we don't use chimpanzees anymore, right? Non-human primates, old world monkeys. But I agree. I agree with you. A new Canadian variant, every day there's a new variant. We just don't pick it up. My virus would be different from your virus. So it's a variant technically. So I have to say something, folks. Listen, today I realized this. So I gave the HIV lecture the other day. And, when HIV arose in Africa and it diversified throughout Africa, wherever it moved in Africa, it diversified into subtypes. And we have many subtypes now, and they spread to all parts of the world. They're variants, basically. And North America, we mainly have subtype B because that's what was brought in early in the outbreak. Whatever virus comes, whatever variant comes, it predominates. Nobody ever said these variants are more transmissible, they're more virulent. They're nothing more. They're just markers of the viruses passing through a population, adapting to that population, and then they move elsewhere. That's all there is to it. And I don't understand the current insistence that these are something special. So the Canadian variant, so what, The U.S. Army has been using, that's right, live oral ad 4 and 7. That's right, to prevent respiratory illness, right? Yeah, that's a good point. And I'm sure that's millions of people. Interesting. I wonder, that's a good point. Thank you, Jack. I'm going to look into that. How do I feel about indoor dining? Well, I think if you are vaccinated, you're good. Obviously, you have to take off the mask to do indoor dining. And I think if they maintain low density, it's fine. But it would be best if everyone were vaccinated, right? Hey there, Lost Laboratory. When do you anticipate fully vaccinated baby boomers might need to begin getting boosters? You mean for next season? I think we have to see what's circulating in, say, October, November, the next season. And then they'll check that out and see antigenically how it matches with what is circulating matches with the current vaccines in terms of neutralization. That's the only assay that they can do. That's what they do for influenza. And so they'll make a decision, although there is the likelihood that they will wait another season to see how the currently vaccinated people fare. That's what I think might happen. Yes, both mRNA companies have a cancer portfolio for sure. So the mRNA is going to be used for that, sure. Okay, so we talked about the break. It's not really breakthrough, the South African variant. And by the way, it's a very small fraction of all the viruses in Israel. Very small, irrelevant. But anyway, it infected people, but it doesn't matter. They didn't get sick. And that's really the point. The J&J vaccine in South Africa, it had tenfold reduced neutralization against that variant, but it still protected 100% against disease, severe disease, and deaths. That's all we care about. And these reports of breakthrough are really not meaningful. Is the 100% effective vaccine for kids the original strain or some variant? Well, the vaccine, of course, is based on the original and the one and only strain, which was the first. It probably has D614G. But it's pretty much like the original virus that arose. And so it is testing against whatever is circulating. And so I don't remember that they actually looked at what was infecting the kids or not. That's a really good question. I'd have to look at it. We did that paper last week. You know, from week to week, I start to forget things now. Is the inactivated virus more effective than the mRNA vaccine? Hard to compare because the trial was done in China as opposed to elsewhere, but the numbers are slightly lower than the mRNA vaccine. Look, the mRNA vaccines are 90% and higher. I don't know. You can't get much better than that, right? Does Pfizer cause a rise in IgE? It shouldn't. No, that's an allergy related antibody, but as far as I know, it does not. Will someone with long COVID get a fever after the second Pfizer? Sure, you could. You may or may not. It's hard to predict. Jacobson versus Massachusetts was a Supreme Court decision that upheld the rights of the states to mandate. Oh, good. Thank you. That's good. Excellent. Yes, Luis, I thought a nonprofit was not a business, right? You don't make profit. A business makes profit. So universities are nonprofit. So I don't get that. Thank you for your super chat. Vaccine hesitancy to me is funny because there's all kinds of public buildings still packed with asbestos, cars with defective airbags, and people shrug. Of course, there are all kinds of things people have learned. Basically, people have learned to live with it, like the clotting issue with birth control pills. It's much higher than 6 and 6.6 million. Yet people have decided that's the risk they're willing to take to prevent a pregnancy, right? And I'm fine with that, but just decide what risk you want to take to prevent COVID. Same idea, right? Yes, that's true. It doesn't go anywhere unless you disturb it. It's right. You start to break it up and cut it. Yeah, for sure. Absolutely. Absolutely. You shouldn't tell her that. She'll get mad. She'll yell at me in the morning. You shouldn't say it that way. Don't say massacre the Constitution. Just tell her you got it wrong slightly. Be nice. Peach ice cream. She might like peach because she likes Georgia, right? Could we get lucky? Could a Nipah virus become airborne and kill tens? Anything is possible. But the more lethal viruses don't seem to do that. Avian influenza H5N1, Ebola virus, Nipah virus, Lassa, they don't really transmit well. Is that a coincidence or is that a biological restriction? I feel it's a biological restriction. And, if you're highly lethal, you're not likely to transmit well. SARS-1 made you very sick, so you were in the hospital at the peak of shedding, and so that's how we contained it. So I think that's the trade-off there. I think it's the trade-off. My understanding is Sinopharm is similar to J&J and Sputnik is identical to AstraZeneca. No, Sputnik is two different adenoviruses, human adenoviruses. And AstraZeneca is chimpanzee adenoviruses, chimpanzee adenovirus 26. And Sinovac is inactivated, so Sinopharm is the adenovirus 5, I think. Some speculate that 1918 flu partly caused CVD epidemic decades later. Do some influenza strains infect the vascular system? Not that I'm aware of. I'm not aware of any of them doing that, no. That's funny. George Papadopoulos, pap smear, right? Yeah, it's pretty funny. Someone wants to know if COVID, Tucker Carlson, yeah, Fox News, right? Wants to know if COVID vaccines work while we're still wearing masks because not everyone's vaccinated yet. We need to get more people vaccinated, and until they are, but you say people who have been vaccinated shouldn't have to wear masks. I think actually that's okay because it's not likely that they're going to be transmitting effectively, but the CDC is deciding to err on caution. So once we get to a certain percentage, maybe 70, 80%, then you can take your masks off. Did the South African variant mutate the spike, making it get past the vaccine? South African variant has changes in the spike that reduce the ability of antibodies against the ancestral virus to neutralize it by about tenfold. But you still don't die because the T cells can still take care of the South African variant because the T cell epitopes do not change. And that's the narrative that no one's paying attention to in mainstream media, okay? So the vaccines are fine against the South African variant in terms of disease and death. You may get infected, the virus will reproduce. You're not going to get seriously sick. Didn't you warn against the vaccines targeting spike? I did, but I thought we should have other proteins to provide T cell epitopes because the spike only provides the antibodies that neutralize infection are only induced by the spike, but the epitopes that induce T cell protection are induced by many proteins. So I thought we should have more. So you're right that the focus on spike has caused this to be a problem in terms of antibodies and neutralization, but I think we're okay because of the T cells, if that makes sense. Was Amy vaccine hesitant? No, I don't believe she ever was. No, absolutely not. I know she wasn't. You know, it's funny how long, how much of a lag there is between me seeing the chat and what we're saying. Yeah, long COVID, the immune system is out of order for sure. So maybe the vaccination kind of restores it. I don't know. Could be. There are laws in the books in Philadelphia to jail or fine people for breaking quarantine for yellow fever. That's interesting because they had an outbreak there, right? Yeah. A year from today, what's the imagined state of things? Normale. For sure, it's going to be normal. There'll be no more big outbreaks. The virus will still circulate. Everyone will not be wearing masks. We'll be going to restaurants. You'll be doing everything you want to do. Schools will be open. Yep. Of course, that's my personal opinion. I could be wrong. And I admit it when I am wrong. Is the benefit of vaccine for long COVID just due to a sort of reset? Yes, exactly. A reset. Or eliciting an inflammatory cascade that allows for a second round of the pro-resolution. Yeah, those are two good ideas. They can be tested. How do I write a letter to TWIV? TWIV@microbe.tv. Very simple. TWIV@microbe.tv. Can higher transmission of VOCs mean herd immunity may be difficult or impossible to achieve? Well, I don't think so. I think the herd immunity that we need is 70%, 80% based on the reproductive index, which is 2 to 3, and I don't think the VOCs change that. That is my opinion. And of course, you're here and I'm here and you're asking me, so you're going to hear my opinion. I already had COVID, confirmed by a positive serum antibody test. I've had the first Pfizer shot. Do I really need the second? Well, we don't know the robust nature of your antibody, so it would be safest for you to get the second shot, yeah. But if you don't, you'll probably be okay. Will bad actors ever be able to engineer a virus to use as a weapon? I don't think so. So you may say, okay, how do you know that, Racaniello? I've been working on viruses for 40 years, and whenever I modify them, they go wrong, they go off, they lose infectivity. It's really hard to make something weaponized. And people tried to weaponize viruses for years. In fact, we had Jens Kuhn knows all about this. He's a virologist, been on TWIV a couple of times, and he's talked about that. You know, the Russians tried to weaponize viruses. They're just not efficient, and there are better ways to make weapons, frankly. Biological weapons are not great. The other kind that we have already, bombs of different sorts, incendiaries, those are the weapons that work. Those are what's going to be used. And, you have the other issue with if you made a virus weapon, it would kill you too, unless you have an antidote, in which case, anyway. In the U.S., many believe knowledge and education are communist plots. Well, I'm not a communist, and I want to educate everybody. I want to be Earth's virology professor. So, as far as I'm concerned, it's not. Mouse strains have longer telomeres. Not sure which strains. They've been selected for that. Okay, thank you, Delineated. Thank you, Post Polio News, for your super chat. How many studio light bulbs that will pay for? Thank you. Anyway, we really appreciate it very much. We're talking about the filtration of the blood here. Do we know if platelet count, low platelet is more common problem for women? I don't know. That's a good question. I'm going to ask Daniel tomorrow about that. Hopefully he will have some insight. Is mask wearing a ritual? No, I would like to not wear a mask. I think it's useful to do. I think if you're fully vaccinated, you probably don't have to use it. But we'll just wait another month or two and see what happens. I might wear it in this flu season again, though. You know, it's maybe a good idea. We'll see. We'll see. Anyway, you're welcome. Vanilla. Hey, Andrew. Kia ora. And we're just getting to the ice cream. Let me try and speed through some of these. I'm sorry that Amy has to leave early, but she has to work, you know. And we're talking about ice cream here. For those who are hesitant, how can we explain the virus has not had a visible impact on the homeless? That's a great question. The other population are drug addicts as well. They haven't been hit in I think, Sweden or Norway. Someone wrote to us on Twiv. No idea. You'd have to find out, right? That's an interesting question, to find out what helped them, and maybe you can apply it to others. And so now we're getting information about the spleen. Okay. Yeah, so Arlene, the CDC recommendation is if you're fully vaccinated, you could have a little gathering in your house of people without masks as long as they're all vaccinated. But, you know, if you go out, if you go to a store or a restaurant, they're going to make you wear a mask, or they're going to ask you to. So I don't know where you're going to go. However, businesses, people don't wear masks. Sometimes people on the street don't wear masks, because who's going to stop you, right? It's just doing the right thing at this point, right? Will there ever be a pandemic with a huge death toll, 10% or more? I think not, because we could go into lockdown and prevent it, right? If it looked like it was really lethal. And, you know, early on, the lethality was like 15%, right? In China. Let me pull up a slide and you can see this. I showed this today. By the way, I'm giving a talk tomorrow to a journalism class at Columbia. Man, it is like 3 hours long. Here it is. Let me pull it up. I want to show you this CFR number from last year. Anyway, it's taking too long to come up. Here we go. It is interesting how it was different in different places in the beginning of the outbreak. Where is it? Here we go. Sorry for the delay. Let's see. Here we go. This is the CFR in different parts of China. So look at here, 25, 20, 15%. This is January 2020. Wuhan, overall China, China outside Hubei outside Wuhan. So you see big differences. And then, of course, you know, over 80, 15% CFR, but, you know, overall 2.8, well, overall 2.3%. And so that's pretty high. 10%, I don't know. It could. Spleen. Rocky Road. Tom, thank you for your super chat. Very much appreciated. In the dairy store, I used to travel to universities, and many of them have dairy stores. Like also, there's one at Penn State that we used to go to also. Thank you, Sandy, for your super chat. Really appreciate the donation. Thank you, John, for your super chat. Can we break out the guitar now? Well, you have to wait a bit because I have to brush up. I have to. I will, but I have to brush up. I want to play. What is that song by? I can't remember. It was originally a Jimi Hendrix song, and then it was covered by the great guitarist from Texas, who I can't remember. Thank you, DR, for your super chat. Are topological defects a relevant concept? I don't know what a topological defect is. I don't understand what that is. Anti-vaxxers say vaccines with EUAs are experimental. Yeah, emergency. They're not experimental, emergency use. Why can't they give approval durability? All right, look, that's just an excuse that the anti-vaxxers are making. So people make an excuse for anything. Like they say, I don't want vaccines made in fetal cell lines. Okay. Or even tested in fetal cell lines. Or that's even been in the same lab as a fetal cell line. So what can you do? You can't tiptoe around everyone, right? Could vaccinated people be shedding? Sure, they could, but not enough to transmit effectively. That's my thought. I think they shed, but not enough to transmit. Otherwise, herd immunity wouldn't work. Is overexpressing spike messing up ACE2's native antithrombotic function? No, because the mRNAs overproduce spike, and there's no issue there with clots. So I don't know if it was covered. Thoughts on the former director of CDC saying the virus was created in a lab? I don't think he knows what he's talking about. I think this reveals he has minimal understanding of how viruses emerge. She said it's too transmissible. Well, that's the point. That's why it was successful. It spread initially in a small number of people, acquired the changes it needed, and became transmissible. That's how it works. I don't know why he can't understand that. He shouldn't have said that because he has no information one way or the other. Would you have different T cells from an mRNA and an adenovirus? You should have the same because they're both making spike, right? That's the key. The spike is going to give you the T cell epitope. Hey, Neva, good to see you. Nice to see you. And thank you for your super chat. Rich mentioned you on the latest TWIV, which will drop tonight. You know, he made this video, which I think was inspired by things that you asked of him. Good to see you. Hope all is well. You bet virus was isolated way back in January of 2020. No question. That is kind of a meme that people are spreading, but it's just not true. Just not true. Novavax is, yes, it's the spike protein produced in insect cells using an insect virus vector. That is absolutely true. Absolutely true. Since COVID is all over the world, what danger to other mammals being infected present new vectors? So we don't know the extent to which other non-human animals are infected. That's a good question. We know that mink and cats and so forth, gorillas can be infected. What about wild mice? So that could be a reservoir. The virus could change in them. Yeah, I think these are all great questions. And stay tuned. That's why you should still either listen to TWIV or come to this frequently. Why is E484 more scary than 501? According to whom? I am not scared of either because the T cells don't care about either amino acid change. They will take care of your infected cells no matter which spike variant you have. But the reason people are afraid is they see antibody titers that can't neutralize E484K more severely than 501Y. But I don't think that matters because the T cells can take over. We are rounding up to the end here. Let's see if we can get some super chat. Ian, thank you again. You are your support is very appreciated. And we'll go towards our studio. Who else? Let's see. No, I don't know why Novavax is taking so long, but we think it's going to be out next month for sure. I'm sorry that we have to pass through all these questions. We're running out of time. I don't want to keep people up all night. Thank you, Susan, for your super sticker. Great questions, folks. I'm very impressed. And Vinnie Rack, who has a similar name to me, thank you for your super chat. And yes, it's scarier because you can shorten it to eek. Yes, Will, you're absolutely right. Oh, gee, it's too bad that Amy isn't here because, yeah, this is very interesting. We're looking into this, why the rhinoviruses have come back substantially, and we're not sure about that. But yeah, they've come back in despite us masking and separating and all that, and we maybe they're transmitted slightly differently. But ask Amy next time. And for the last comment, James, thank you. I appreciate that you think I explained things well. I just want you guys to have your questions answered. Come back next week. Thanks, Wendy, for your super chat. Come back next week. We'll be here again, Amy and I. And why did they vaccinate the gorillas with human vaccines? Well, that zoo person who did that, she's going to be on TWIV Friday, so stay tuned. What a great way to end it, folks. Thanks so much for coming, and we will see you next time.